My name's Devin Wurman, and I'm a physical therapist here at Loudoun Sports Therapy Center, and I'm here to give you a little bit of information about foam rolling. Foam rolling has gained a lot of popularity in the last couple years. There's actually not a whole lot of research out there on foam rolling, but I can give you some good pointers about how to do foam rolling safely and not to cause more injury, and when you would actually need to use a foam roller. So here is a standard foam roller, and it's white, and there are different kinds of densities. This is the lightest density. So pretty much you would want to start with something like this so that it's not a whole lot of pressure. Warning, foam rolling you can be sore with, and you will be sore with, but as you keep doing it on a day-to-day basis, it will get a little bit easier as the days go on. So what would you use a foam roll for? Foam rolling is really good for some trigger points in certain muscles, or even your IT band along the side of your thigh here that tends to get very tight with a lot of people, especially if you're a runner or play sports. So this would be a good tool in addition to stretching and strengthening, which will help alleviate some of that tightness and tenderness. So the biggest thing with a foam roller is that you don't want to overdo it. That is the number one thing that people tend to do with a foam roller, is that they overdo it. They think you have to do it for several minutes at a time, but that's not true. So what you want to do is take the foam roller, put it down, and I'm going to show you how to do the IT band with the side of the thigh here. So you want to get down on the floor with it, and you always want to start right underneath what we call a bony prominence. So anything sticking out that you feel hard is your bone, and you don't want to roll over that. So you want to start right at the bottom of that underneath, and you want to go to the length of your entire IT band like this, just to about the knee joint right there. So you want to go slow and controlled. You don't want to go really fast, and you want to put decent amount of pressure where you feel like you're actually doing something but that you're not in agony with, and you're just going to go up and down, and I'm talking 10 to 12 repetitions only. That's where I talk about not doing too much. You only want to go up and down 10 to 12 times, and that is sufficient for each thing you want to actually foam roll. So the other one I wanted to show you that's a pretty common site to foam roll is the glute buttock muscle back here that tends to get tight a lot of time. Some people have knots that form back there, and they get really tight and can even cause pain coming down the leg and sciatica. But even if the muscle back here is pretty tight, this is an awesome way of actually getting that knot out. So what you want to do here is, if it's my left one, you're going to kind of put pressure through that left buttock muscle there, and just slow and controlled right over the muscle. Remember, you don't want to go over any kind of bone, and do only 10 to 12 repetitions. So after you're done with that, that's literally all you have to do for the rest of the day. Max twice a day. Once a day is totally fine, and only the 10 to 12 repetitions. And this will become an added benefit to your normal exercise routine, because it can get out any of the trigger points or knots that you may have. If you have any other questions about foam rolling, or you have any other questions about pain in general, we're here to help you. So just give us a call here at Loudoun Sports Therapy Center at 703-450-4300, and we can answer any of your questions.